rather than reacting to an episode makes more sense than the current sick care system, as it was never designed to deal with the huge growth of chronic diseases. How about if we start looking at the healthcare industry from the perspective of the patient? That is, first to help the patient understand the drivers that impact their chronic conditions so they can play a more active role in managing it. Now, it's not just about telling them what to do. Most people who smoke already know that it's bad for their health. It is actually about truly engaging them, providing them with smart technology so they can closely monitor themselves. The aim is to proactively keep them well rather than react when they become ill. This is where I'm excited to learn more from Irma Rastegayeva. Irma is ranked number 3 in top 50 digital influencers in healthcare and the top 30 women in tech influencers. Irma is one of the thought leaders in telehealth and also serves on the board of directors at the American College of Healthcare Trustees. She now combines deep technical expertise, product development experience, and patient advocacy with storytelling and connectivity at eViRa Health. Thank you for joining us, Irma.
Hi, my name is Irma Rastigava. I'm a co-founder of eViRa Health, and we'll talk about the wearables, microfluidics, and the importance in the COVID-19 era. So what are wearables? Wearables is an umbrella term for a wide variety and category of wearable technology and electronic devices that can be worn hands-free, embedded into accessories and fabrics, tattooed to or adhere to the skin, and even implanted inside the body. We could say that the origins of wearable technology go back to the 13th century when eyeglasses were first invented, but really, modern wearables are sophisticated devices. Using the computing power of the microprocessor, they contain motion or other sensors that track information in real time, with many devices transmitting it wirelessly via the internet. The rapid evolution of wearable devices was made possible by microprocessors becoming small enough and by the growth of high-speed mobile networks. This rapid growth and evolution of wearables coincided with the rise of the Internet of Things technology, also known as IoT. At this time, the applications for wearables are quite wide-ranging. From this technology's early uses in the military and the space program, to more recently, fitness trackers, smartwatches, fast-growing use in medicine and healthcare, head-mounted displays. Basically, the field of wearable technology is exploding. One example where this explosive growth was evident was at the Consumer Electronics Show, CES, in January 2020, where the healthcare was the fastest growing category with a 25% increase from the prior year. Wearables were a star of the show with many new form factors and use cases. Today, I'd like to focus specifically on the applications of wearables in healthcare and how wearable medical devices are changing the medical technology landscape, an already growing trend that has been further accelerated by the global coronavirus pandemic. Of course, we know that most of the wearable devices make contact with the skin. Skin is our largest organ. It is our primary barrier to the external world, and it is the body's first line of defense against infections and damage. Skin is helping us regulate key functions, such as body temperature and internal fluid balance. Individual skin variabilities due to the age, sun exposure, and overall health do affect how wearables perform and must be taken into account by medical device designers. We as users of wearable devices might not realize just how many design factors need to be considered. These include material breathability for proper moisture control and comfort, as well as wear time and specific uses, which in turn influence other decisions, including material selection, power management, and durability. Designing for skin is a challenge, and yet there are even more aspects of the wearable medical device that need to be considered. For those patients that use wearables to manage a serious chronic condition, A sudden loss of power to the device could be potentially life-threatening. The severity of medical condition, battery capacity, and whether or not a wearable requires sterilization all need to be considered. In a short period of time, COVID-19 has altered our individual and collective behavior, changing both healthcare and workplaces. Technology offers tools to meet these new challenges. When it comes to health, work, and economics in the era of COVID-19, wearables have an important role to play in the entire continuum of care, as well as in our work and leisure lives. Good population health approaches and personal hygiene practices like wearing face masks and hand washing go a long way towards helping to slow the spread of the coronavirus and flattening the curve of the pandemic. But beyond these measures, technology can be a powerful ally. New research shows promise in wearables' ability to detect early coronavirus symptoms. Stanford Medicine's 2017 research demonstrated that health data collected from wearables can help detect infectious illness days before any noticeable symptoms emerge. Recently, Stanford Medicine researchers, in collaboration with Fitbit and Scripps Research, have launched a new effort aiming to detect early signs of viral infection through data from smartwatches and other wearable devices. Because wearables, including smartwatches, make hundreds of thousands of measurements per day, they make for powerful monitoring devices. We know that when a human body fights off an infection, there are some physiological signs, including rise in skin temperature and elevated heart rate. By continuously measuring these, wearable devices could help alert us well before humanly perceptible symptoms appear. This technology, combined with smart algorithms, could not only warn an individual of the onset of their infection, but could also be used at the population level to track contacts and potential infection transmission in communities, helping curb the spread of viral infections such as SARS-CoV-2. The global scale of the COVID-19 pandemic brought the need for scalable coronavirus testing and other COVID-19 solutions into sharp focus. The field of microfluidics offers some practical ways to aid in this pandemic. Microfluidics is a decades-old field that combines engineering, physics, and nanotechnology with chemistry, biochemistry, and biotechnology to design systems that can process super low volumes of fluids to preserve resources and to achieve high throughput screening and automation. There have been numerous advancements in microfluidic technology over the past several years, which is proving to be a timely development, given how important it is in the context of the global pandemic to gain immediate insights at scale, especially without wide availability of traditional testing methods. Microfluidic devices play an important role for point-of-care COVID-19 diagnostics. Microfluidics make lab-on-a-chip technology possible. Lab-on-a-chip can be used in COVID-19 testing and offers specific answers and actionable insights without the need for complex in-office testing. With non-invasive and minimally invasive microfluidics, required answers can be obtained from a tiny blood sample. Compared to a more involved interaction during the medical office testing, reducing invasiveness is critical to protect patients and providers from the virus. Lab-on-a-chip also makes the serology or antibody testing for signs of previous COVID-19 infection possible. While active COVID-19 testing capacity is still lagging in the US, antibody testing could identify individuals and populations that have had COVID-19. Understanding COVID-19 pervasiveness in our communities is important for public health. With high risks of exposure to the coronavirus during the pandemic, many hospitals and doctors' offices were mandated to close for months, and as a result, regular healthcare has been disrupted for millions of Americans. Here too, wearable technology can come to the rescue for some conditions. Wearables allow patients to track their vitals and overall health data then share results with the healthcare provider without physically going to the doctor's office. Other enabling technologies for virtual care, such as telemedicine, have also been widely adopted during this global pandemic. Telemonitoring, possible through wearable devices, is critical for patients, especially those with chronic diseases and other underlying conditions. Wearables allow patients access to their health data quickly, giving them, their caregivers, and physicians insight into health ground truths, so patients can better take care of themselves. Increasing use of wearable sensors will further empower patients to gain deeper insights into their health and well-being, allowing for a shift from big data to more individually actionable small data. COVID-19 is further accelerating shifts in healthcare that started even before the pandemic. Patient-centered and patient-empowered care has been increasingly gaining traction. Patients, their caregivers, and families are looking for sustainable solutions to chronic disease management that are more cost-effective and better fit their busy lives. Wearables are well-positioned to become vital tools in helping to monitor people's health, detect early signs of illness, empower patients, and give medical providers a glimpse into their patients' health-affecting habits and lifestyle outside the doctor's office. The increasing trend of consumerization in healthcare resulted in patients expecting personalization from all their devices, including health-focused wearables. For patients to be compliant with these wearable devices, they need to be designed and developed with the user in mind. Designing durable, lightweight wearable medical devices that can reliably help patients, their caregivers, and healthcare providers monitor and manage chronic diseases is a challenge. But when the complex science, understanding of the human body, and medical device know-how all come together, the resulting products can change our lives for the better. Thank you.
Thank you so much, Irma. Great talk. How do you describe the role of wearable tech in the age of 5G in addressing the challenges of geographical accessibility in healthcare?
So wearables has the potential to become that widespread technology that really offers access to healthcare to those that might not traditionally have that access. And 5G is vital to provide the kind of connectivity that could really empower those devices to be distributed far and wide. Now, 5G is one of those enabling technologies that we see really important in enabling a variety of other technologies like wearables, but also telemedicine, telehealth, telemonitoring, and wearables are one piece of that puzzle.
Thank you, Irma. Great talk. Now, with the increase in remote consultation, how do you think this will impact the empathy part?
This is so interesting. I think there is a movement that patients and patient advocates support in healthcare where we want technology to be allowing doctors to go back to the practice of medicine where their time and their empathy could be used to improve patient care. So by using technology to give physicians and other healthcare providers additional insights into their patients' health could free them up to have the time to listen to patients in addition to all the data that they already have access to, and all the algorithms and AI can help them derive insights from that data. So empathy, as you know, is an important part of healing and an important part of medicine. And we need to give the tools to healthcare providers to have the time and the energy to tap into their empathy and get back to the practice of medicine with the help of technology.
Amazing. Thank you so much, Irma. It was great to have you.
Appreciate having being here.
Stay with us at the XR 2020, a VRARA Association MENA Chapter Spectacle, sponsored by Munfarid in collaboration with HP and DTech Debate. Great talks yet to come on XR and AI and their impact on the quality of healthcare across various settings.